Evaluation of a real-time computer-aided polyp detection system during screening colonoscopy, AI Detect study. Introduction. Detection of polyps during colonoscopy is critical in reducing colorectal cancer-related morbidity and mortality. Screening programs are particularly effective at reducing these risks, with high-performing operators undertaking colonoscopy. Colonoscopists with a higher adenoma detection rate more effectively protect patients from development of post-colonoscopy colorectal cancer, PCCRC, compared with colonoscopists with low detection rates. Among endoscopists, there is a recognized polyp miss rate of 26% for adenomas and 27% for serrated lesions, according to a recent systematic review and meta-analysis of tandem colonoscopy studies. This may, to some extent, explain the significant level of PCCRC occurring within 36 months of a negative index colonoscopy. However, within a bowel cancer screening program setting, PCCRC 3-year rates have been shown to be lower at 3.6% compared with an overall unadjusted rate of 6.5%. This may be due to level of experience and technical skill of colonoscopists participating in bowel cancer screening programs. Human detection of polyps has limitations due to issues such as the amount of time spent cleaning the mucosa when bowel preparation is inadequate, optical diagnostic skills for recognition of subtle flat polyps, and fatigue or distraction resulting in human error. In recent decades, there have been significant advances in AI-based systems which use algorithms to perform tasks that would usually require human intelligence and input. These algorithms can be trained to perform tasks by recognizing patterns in data, machine learning, rather than being programmed. Using this technology, computer-aided polyp detection systems, CADe, have been developed to automatically highlight detected polyps in real time during colonoscopy. AI systems might reduce the degree of variability in polyp detection among endoscopists and could help reduce human error. However, prospective studies in a real-life clinical setting are lacking. Therefore, studies are required to assess effectiveness and acceptability of these novel technologies before widespread clinical use can be recommended. The aim of this study was to evaluate the first clinically available polyp detection system in terms of effectiveness in real-life clinical practice among a group of experienced colonoscopists performing bowel cancer screening colonoscopies. Methods. This prospective, randomized, controlled trial involved all 8 screening-accredited colonoscopists at an English NHS bowel cancer screening program center, February 2020 to December 2021. Patients were randomized to CADe or standard colonoscopy. Patients meeting NHS criteria for bowel cancer screening were included. The primary outcome of interest was polyp detection rate. Results. 658 patients were invited and 44 were excluded. A total of 64 patients were randomized to CADe or standard colonoscopy. 35 cases were excluded from the per-protocol analysis due to poor bowel preparation, an incomplete procedure, or a data issue. Endocuff vision was frequently used and evenly distributed. On intention-to-treat analysis, there was a borderline significant difference in polyp detection rate, 85.7% versus 79.7%, but no significant difference in adenoma detection rate, 71.4% versus 65.0% for CADe versus standard groups, respectively. On per-protocol analysis, no significant difference was observed in these rates. There was no significant difference in procedure times. Conclusions. In high-performing colonoscopists in a bowel cancer screening program who routinely used endocuff vision, CADe improved polyp detection rate, but not adenoma detection rate. CADe appeared to have limited benefit in a BCSP setting where procedures are performed by experienced colonoscopists.